Do you want to see what childhood trauma does to a person? I'm a trauma therapist and I ask about these 10 childhood traumas to every patient that I work with. An increase in the frequency and intensity of childhood trauma is linked to things like substance use, increase in missed days work, increased chance of obesity, depression, STDs, cancer, stroke, COPD, the list goes on. And the increase in childhood trauma leads to the increased likelihood of a premature death. So these are the 10 childhood traumas, and honestly, I believe every healthcare practitioner should be asking their patients these questions because of the links between physical illness and childhood trauma and toxic stress. So there's 3 broad categories: abuse, neglect, and household dysfunction. There's physical, emotional, sexual abuse, physical and emotional neglect. If a family member or member of the household was incarcerated, has substance use issues, mental illness, if there's domestic violence, if there was a divorce. It's also important to ask about these using direct, objective language. Don't ask if you were abused or neglected, because oftentimes there's either an emotional ramification to saying, yes, I've been abused, or they don't think of it as neglect or abuse. Asking if you were hit, beat, punched, threatened, kicked, or at times you felt like no one loved you or thought you were special. And again, I want to highly emphasize the importance it is for not just healthcare workers, but also our educational system to help screen for childhood trauma because of its ramifications throughout society, and to help normalize this discussion because mental health is often linked to social connectedness. And so I want to change the question that you've been asking yourself from what's wrong with you to what's happened to you.